Hello and welcome to Your Health DeKoded. Health experts are alarmed by the increasing rate of heart attacks among adults in their 20s, 30s, and 40s. A demographic previously considered low risk. This troubling trend challenges our understanding of heart health and raises urgent questions about modern lifestyle factors, stress, diet, and potentially undiagnosed conditions affecting younger generations. Today, we'll examine what's behind this disturbing shift, identify the warning signs everyone should know, and discuss preventive measures that could save lives. Because when it comes to heart health, age is no longer the protection we once thought it was. Joining me is one of the most eminent cardiologists in this field. I have with me Dr. Ashok Seth of Fortis Escorts. He's the chairman of the Fortis Escorts Heart Institute and the chairman of the Fortis Medical Council. I got that right.
Yes, you have.
Okay, you know, it is just so troubling because literally every month, just very recently, there was a very famous Kannada film called Kantara, and one of the leading actors in it, a 33-year-old man, had a heart attack suddenly and passed away. What is going on?
You know, we realize, and these sudden cardiac arrests that we see unfortunately on these visuals, 80% of them are due to heart attacks.
Right.
Now, there's a difference between sudden cardiac arrest, what we see, and heart attack, because heart attack is a condition where you are able to feel the discomfort, rush to the hospital in most instances, and have treatment as needed. But 10% of the heart attacks prevent as cardiac arrest. So what we see in young people at the moment between 20s and 50s collapsing is most likely due to heart attack. But if we see someone like a 13-year-old, we've seen those visuals as well collapsing and not surviving. That collapse could be many other things rather than heart attacks. That could be even a congenital abnormality of the heart. It could be arrhythmias. It could be irregular disturbances of the heart. And many conditions, even a viral infection of the heart can result in myocarditis and a collapse. So we need to differentiate and understand that very early collapses that we see, and that's why I want to dispel this fears and myths saying a 13-year-old girl had a heart attack and collapsed. That wasn't a heart attack. That was a cardiac arrest due to other issues than blocked arteries. So when we refer to heart attacks, we're talking about arteries of the heart blocking off, causing severe chest pain. As you know, heart attack is a medical emergency and people rush to the hospital because 10% of them will suddenly collapse, have the irregular heart beating where the heart stops. Those 30-year-olds, 40-year-olds, 50-year-old collapsing are certainly heart attacks.
So you're saying there is an age limit?
Not an age limit.
Huh.
There's a difference between heart attack and the sudden collapse and cardiac arrest that we see on those visuals.
Okay. So,
cardiac arrest is a rhythm disturbance where the heart stops.
Okay.
And it stops there, and if the person is not revived at that time, that person is a dead person within a few minutes.
So the younger ones, possibly the under 20s, you're saying is more likely sort of stopping because of an irregular rhythm, and over that it could be.
Yes, absolutely. And that's why I want to differentiate it, because sometimes in the media comes a 13-year-old or a 14-year-old suddenly collapse in school, and it's reflected as the 14-year-old has a heart attack.
Right.
No, that could have been even a congenital abnormality of the heart. That could be a viral infection of the heart. That could be certain conditions which run in the family, which cause sudden cardiac arrest very early in life. But you're right. When we talk about the younger people, yes, heart attacks are on the increase in the younger people, and that's what we say at the age less than 50. Can you believe that in our own country, heart attacks in the young age, which means 20 to 50 years of age, has risen by 300% over the last 20 years. 300%, 3 times. And that's really worrying because at the moment, 50% of the heart attacks are less than 50 years of age and 25% are less than 40 years of age. Now, these figures are totally different to the West. In West, you rarely see a heart attack less than 50. That probably constitutes less than 10%, what we're talking about 50% in our own country.
And this
in the West, by the way, heart attacks and deaths from heart attacks decreased by 50% over the last 30 years. We increased it by 300% over the last 20 years.
But isn't it more after COVID? Haven't you seen more of it after COVID? I'm not trying to draw any sort of linkages or comparisons, But it is after COVID that we're suddenly seeing, this sprout of...
Let's put it in a different manner. Heart attack in the young is multifactorial. It's not just one factor alone. And there are reasons why this has grown to 300% over the last 20 years. And we're the heart attack capital of the world. 50% of the heart attacks all across the world happen from our part of the world. COVID was one of the factors. There's no question around it. And COVID resulted in a 200 to 300% increase in heart attacks. And it's been well documented on follow-up studies. But it was one of the factors. Actually, what we see more and more of visuals and recordings and so on and so forth is actually one, of course, the fact that the social media has grown immensely, and therefore these visuals appear more commonly than they would have appeared in the past. But certainly, there's an increase in heart attacks, and therefore we're capturing those visuals, but in a way, while they are so, so disturbing, those visuals, I say that the silver lining in those is a realization to the public through those visuals that we got to take care of ourselves and that anyone can be prone to a heart attack. India is a world capital of heart attack. We as Indians are 3 times, even without any risk factors, by the way, as a race, we are 3 times more our chances of getting a heart attack that compared to the white Caucasians, 6 times more than Chinese and 20 times more than Japanese of just having a heart attack. It's been seen that Indians who've lived for 3 generations in the West Indies or in 2 generations in the United States or 2 generations in Singapore, Indians have a higher incidence of heart attacks as compared to the local population, even though the food habits haven't changed, have changed to the local food habits. Yes, we are, therefore, COVID did increase that. COVID was one of the indicators, and 300% increase in heart attacks have been documented in those who had COVID, and practically most of us did have COVID.
Are there any warning signs? Are they, actually, what I really want to know is, are there any genetic markers? Are there tests that people can do to identify that they are possibly prone to heart attacks or heart ailment? Is there something they can do? I know there are these annual checkups that a lot of people are now doing, but is there something else?
Yeah, I think firstly, of course, we got to understand why this has happened.
Right.
I think it's also important to address that, and then I'll come to these markers that we talk about. There's no question that family history is an important aspect of heart attacks. Anybody in the family, which is the direct family, which means parents having a heart attack at an early age, and we're not talking about beyond the age of 60. Heart attack can be an aging process and is not unusual after the age of 60 as blockages develop as an aging process. But we talk about a family history when parents have a heart attack or sudden cardiac death less than age 60. That's a very strong, or brothers and sisters have a heart attack at an early age. Sometimes it does transfer to uncles and aunts as well, but really it's a direct link. Anyone who has that is at a higher risk of having a heart attack, and it could be due to a number of reasons. The second and third most important thing in our life is high blood pressure and diabetes. That's increased immensely.
Yes.
A third of the population is hypertensive. Diabetes has increased by 200% even over the last 15 years. So we're becoming the hypertension and diabetes capital of the world, which are the 2 important risk factors for heart attacks or coronary artery disease. Smoking has increased immensely over the last 15 to 20 years. And that's why we're addressing the young population, that these are the factors. Their sedentary habits, lack of exercise. What has increased is bodybuilding, going to the gym, looking fitter, the exercise and look more smart. But what has not increased is healthy exercises, heart healthy exercises.
What are heart healthy exercises?
Oh, that's a great question, and we could come to that.
Yeah.
So heart healthy exercises, can you believe, is a brisk walk, 200 minutes a week.
That's it.
That's it. So what does that transfer into? And I want again for you viewers to understand that bodybuilding and gymming with heavy weights is not necessarily a great heart healthy exercise and may not decrease your risk of any heart attacks. And what would decrease the risk of heart attack is aerobic exercise. And the best aerobic exercise is brisk walking 200 minutes a week, which is 40 minutes 5 times a week. 5 minutes build up, 30 minutes of brisk walk, 5 minutes cool down. Now, what you say, what is brisk walking? I mean, brisk walking for you and me could be different.
Could be very different,
I could be very different, and someone else could be very different. And the way we qualify brisk walking is that you walk outside. You can, of course, walk on a treadmill. You can even cycle. But if you're walking outside and you can only speak a single sentence to a colleague who's walking with you, and you can't speak any more, that means you've got the right pace of walking. You know, people go out for a walk and say, oh, we walk every day. And they've got a group of 5 and they saunter around. And everyone has a laugh and they are talking. And then they say, oh, we had a great exercise today. Well, that's not a great exercise. So that's what it is. Now, anything beyond that. So someone says, but I really walk briskly and I can do that for an hour and a half. Does that increase my heart health? No. Just the 200 minutes can decrease your chances of having a heart attack by 25%. And 25% decrease in chances by just healthy exercise is a huge thing, which many of the medicines even don't achieve. Now, when you come to this issue around what about walking for an hour, what about walking for an hour and a half? That can make you lose weight. That can make you fit. It can increase your stamina, but it doesn't add on anything more to your decrease in the risk of a heart attack.
Right. So 45 minutes brisk walk, and you're on your way to hopefully
decreasing your chances of a heart attack. And by the way, that doesn't mean you have to walk alone. Supposing you can cycle, you can swim. These are aerobic exercises.
Right.
And that's what the whole issue. When we lift weights and heavy weights, it's an aerobic exercise. We actually pushing against something where we really have to struggle hard to push. And that actually strains the heart a lot more. So it's been seen that sometimes joggers collapse and die. Footballers collapse and die. They push their heart to beyond a particular limit. And if they push suddenly, and if I was to suddenly decide tomorrow that I think I should run a marathon, so let me start out by running a mile, I have higher chances of collapsing because I may rupture one of the small blockages in my artery and suddenly have a heart attack.
Wow. So tell me, if I'm 60 years old, are the warning signs different than if I'm a 30-year-old? Are the warning signs different?
So I know you started off by the warning signs and what are the indicators and markers, and we just talked about the family history.
Yeah.
And of course, I think let's also cover we'll cut to the warning signs if we cover the fact that how do we know we are at a higher risk? So I always keep saying, know your risk factors. You don't have to get exhaustive tests done to know our risk factors. Because while we've said that, and smoking and obesity and being overweight, and the things that we don't, that can be easily picked up as a risk factor while we have a family history which is known to us. It's unfortunately high blood pressure and diabetes are silent killers. We don't have symptoms from them. And therefore, just a single checkup with any general practitioner.
Of just these two things.
Yeah, of just these two things, knowing that our blood pressure is doing fine and our sugar is okay, picks up the two most important risk factors. And finally, third is cholesterol, which we never know. And if you got a family history, and then we say, okay, just one cholesterol test, it's anywhere between 20 to 40 years in our age. And I would also recommend, somebody who's got a family history, between 20 and 30 years of age, just a cholesterol test will pick up highly raised cholesterols, which is one of the causes of genetic transmission of heart attacks. Once we've ruled these out, we already know on those cholesterol tests, on diabetes tests and high blood pressure tests, and the family history that we are at a low risk. What is then left for us? Our bad habits. And that's what remains. If we are overweight, if we're sedentary, if we eat bad food, if we are stressed.
Bad food is such a component nowadays. I mean, dietary habits, everywhere that you see people, there was a recent study where people are eating out more. And, I'm not saying, well, that's necessarily a bad thing, but I think it then adds to, processed foods or
trans fats.
Trans fats, exactly.
And that's what's the real color. So often people say, but मैं तो खाना अच्छा खाता हूँ, मैं तो I eat very little fat. But it's not the fat. It's the type of fat that
Yeah.
we eat. It's the recooked oils and the recooked food or the bahar ka khana hai in general, and much of the stored food and biscuits, etc. We never look at the trans fats in it.
Right.
So it's not the fats which are bad. It is the type of fat which is bad.
So what is the type of fat which is good? What is the type of fat that's bad?
Okay, no fat is bad.
Okay.
Fat, by the way, is needed in our body.
Right.
All our nerve cells are made of fat. All the nerve transmissions, it's needed for absorption of so many of the vitamins that we actually take. What's bad is these trans fats, the hydrogenated fats. These are fats which are artificial and or
So
cooked
processed
again
foods.
and again. And processed foods.
Yeah.
Absolutely. Processed foods have to be processed and kept stable because their fats is a trans fat. So anything which we see, which is either being recooked and the oil is being cooked again and again, and that is what most of the food outside is, as you know.
Yeah, yeah.
Whether we go and eat fries or whether we go and eat samosas,
it's the same-
and it's the same,
same-
oil which
Yeah.
has been again heated throughout the day. That oil contains a lot of hydrogenated carbons, which are the real ones which actually destroy our coronary arteries. And that's why we say that the food is not the issue. It's the type of fat is the real issue.
Got it.
The second aspect
I'm
in
going
all
to be
this.
very careful now with my McDonald's fries. Yeah.
So the other aspect, of
Yeah.
course, of life is that these should not become a usual part of life. This has to become an occasional part of life. And usually that's when, patients ask me after they've had a heart attack or after they've had a procedure, saying, "Ab ghar mein jaake khana kya khaye?" And I say, "Khana, just go and eat home cooked food. Ghar mein aajkal kaun khana kharab banata hai?" Everybody is very sensible about what they cook and what they eat. It's never floating oil all over the place. It's the food that we have outside, and I say, घर का खाना तो कभी खराब नहीं है. आप बाहर का खाना कम खाइए, and make sure that's an occasional part of life and not a regular part of life. But another interesting aspect in India is कि खाने पे बड़ा जोर होता है. It's almost like when a person's had a heart attack, उसको तो आउटकास्ट बना दिया जाता है.
खिचड़ी
खिचड़ी
खाएं, सूखी
सूखी roti,
yeah,
and
all of that.
and a dry, and
Yeah,
the whole thing is
absolutely,
this,
yeah.
and the rest of the family continues to
Is
eat
eat,
lovely
yeah.
meat, and he sits out as
Yeah.
almost that he's अब तो बीमार बना
Yeah.
दिया. So often they come back after a month, and then they're saying, हम तो इतने, I'm feeling so weak, I'm feeling so exhausted, I'm
Because-
just tired,
yeah.
and I've lost 4 kilograms in weight. And the rest are eating a different food, and I say, बेचारे इनको भी वही खाना खिलाइए या आप वो खाना खाइए.
Yeah, because at home, who's reusing oil
Who's
anyway?
reusing oil anyway?
But another thing that I wanted to discuss with you today is menopause women and heart health. That's kind of really come into the forefront.
Oh, yeah.
A lot of women above the age of 50, I mean, in fact, a lot of women are now menopausing at 45. And they are sort of really seeing a lot of sort of, heart conditions and sometimes irregular heartbeats. So what is happening there?
Yeah. Okay. I'll address that. I just wanted to add on a sentence to what I said, and just about the food habits. Food fads are non-sustainable and certainly not good for the heart. What I mean is, extreme fasting and the
Food fads,
food
basically.
fads. Food fads.
Yeah. Food fads. Yeah.
Yeah. You may have intermittent fasting. You may suddenly juicing. And suddenly it's all about healthy drinks alone and so on and so forth. Non-sustainable.
So everything in moderation.
Everything in moderation is going to be great for heart. And you raise a very important point about women. We should always address that. 25 years ago, 30 years ago, it was quite clear women are protected from having heart attacks because of the hormonal protection. And it's therefore we would always say less than 50 women rare. It's very rare to have a heart attack, and it's only the elderly as you go on in age. Well, it's very clear. The biggest cause of death now in women is heart attacks, is coronary artery disease. It's 6 times more common than cancer. And look at how much we've been concentrating on cancer for women, rightly so, in terms of detection, prevention. And yet we've not emphasized the single fact that less than 50 women are as prone as men to have heart attacks. It's become the single most important risk factor and killer in ladies, and has risen by 200% again over the last 20 years.
Why?
And this is again, it's all lifestyle related issues. Women are in the same lifestyle as men at this time. When we talk about that, we're talking about similar habits. We're also talking about the fact that it's a stressful world, competitive world, workplaces and every organization, it's stress. And in addition to that, the same factors come in. Pollution has added on to an increasing incidence of heart attacks. COVID added on the next increasing incidence of heart attack. And stress is a very important factor which is now there for heart attacks. These three factors have increased immensely, have been equally, if not more, in women. And therefore, in women, it's also a lifestyle-related disorder. But what's happened also, and smoking in women has increased, hypertension, diabetes, all the risk factors have increased. However, what's unfortunate, and this is why I say so, is deaths from heart attack are higher in women than in men. And the reason for that is that women are presenting later than men when they have coronary artery disease. Often undiagnosed, often not understood. The symptoms are different in women than in men.
How are they different?
And it may be just breathlessness on walking. A man usually has discomfort in the chest on walking, which gets relieved at rest. That's a warning sign that a blockage is coming there inside my heart arteries. And they often seek assistance for that, that I'm now feeling uncomfortable, I can't walk as well I could, I've got this discomfort coming on. Women may just have breathlessness, may have atypical symptoms, may have just nausea. In fact, often a heart attack, which is usually a severe compression on the pain and discomfort and nausea and vomiting, which seeks attention straight away, कि ये तो कुछ हो रहा है, I better rush to the hospital. In women, can just be mild discomfort. It could just be acidity, it could just be breathlessness, it could just be nausea, vomiting, and therefore could go unnoticed. And this is known factors. So we are now emphasizing to ladies that firstly, you need a checkup as much as the men do.
Right.
Don't live in this two factors, that firstly women are protected, they're not, but also the factor that we are women are always putting their men folk in the house ahead, saying आपको checkup कराना या आपका checkup हम ले जाते हैं कराने. But I think I'm going to emphasize that women are probably more important to our nation than men and our need. I think I would say the other way around. Men need to now take their women for a checkup, much more so, because at the end of the day, women really are going to miss out their symptoms, either going to put themselves behind, either say we are the last persons, so sabka checkup karate hain, would look after the family all the time, would take the pressures of family, the stresses of the family, the stresses of children, the stresses of everything else around the world, and the stresses at work. So I think there is an increase in heart attack, a realization, and we need our women to come up front and say, let's have checkups as much as men do.
So as we close this, what would you recommend for people in India? Start having checkups, regular checkups as early as the age of 20, 25. What would you recommend to ensure that, suddenly
so if there is a family history of heart attacks and sudden death at an early age, there is no question in my mind that a checkup would start by the age of 15 even. By 20, definitely. And there are 2-3 checkups that is needed. And those are, by the way, not even specialist checkups. Like I said, they're GP checkup. An echocardiogram, which is just a scan of the heart. An ECG, which is straightforward. Make sure no diabetes, which is blood sugar, blood pressure is okay, and cholesterol tests are fine. And that, if normal, by the age of 20, just needs a checkup every 5 years as we go along.
Oh, every 5 years, not every year.
Not every year.
Oh, okay.
Okay. But if an abnormality is found in these, then of course the checkup gets every year.
Right.
And then I say that you do have exhaustive checkup, because if it's just cholesterol, that gets treated early age. You got a family history, you got raised cholesterol, gets treated every year. And then a blood test every 6 months to a year would actually just say, make sure that the lifestyle is healthy. Make sure that we avoid any other factors that we add on. The reason for that is our risk factors are not additive. Supposing I've got a family history and I just have raised blood pressure, it is not 1 + 1. That makes me 3 times or 4 times at risk of a heart attack than a normal population. Now, if I started smoking, it would make me 10 times more susceptible to heart attack. And if I became obese and my cholesterol went up, I'd be 20 times more susceptible to heart attack. So what we're saying is it's multiplication of risk factors, and therefore they're not additive. I just don't become, I've got 4 risk factors, so I'm 4 times more risk. No, I'm 25 times more risk than anybody else.
Right.
Actually, when we talk about this, and you said this correctly, on the Women's Day, I said, you know what I said? I said, women, it's not you that you've got to take, you've got to take care of yourself. And you have to have tests. But I'm today telling the men folk that you need to take your ladies out for tests. Take care of them as much as they take care of everyone else. But coming to this about risk factors ourselves, at the end, we talk about so many policies. We say, ye policy, wo policy, we're not doing enough for heart attacks, we're not doing any. When I talk about saying that our youth, 25% our youth less than 40 is having heart attack, if 50% at the moment we say in our country is youth, less than 40 years of age, if we have an increasing 300% of heart disease in 20 years in our youth, you can imagine what's going to happen in times to come when even age adds on to that risk factor. We're going to have so many heart attacks happening in our own country that we would not be able to take care of heart attacks. And heart attacks damage heart. Heart damage leads to numerous other complications. So preventing heart attacks as a nation doesn't need policies. It just needs an individual to realize that even I, Ashok Seth, sitting here, could be at a risk of a heart attack. And therefore, I just need to define my risk factors through simple investigations, need to understand what I am harming myself with in addition to the risk factors. And therefore, I can take care of it myself and prevent heart attacks in myself. If exercise can decrease the risk of heart attack by 25%, and then taking away the other risk factors which are in my hands of obesity and getting sugar under control, then I can decrease the risk of my heart attack, of my having heart attack by 75%.
So I think, it's so interesting because it's so basic as well,
it's
right?
Basic.
It's just be a little aware, just be a little careful, and just don't go overboard with anything.
Absolutely.
Moderation works.
Moderation works immensely. We talk about brisk, what are we talking about? Brisk walking. If you can't walk briskly, just climb stairs in your office.
And don't take the lift.
Don't take the lift. Just climb stairs in the office. Just park your car slightly further away and walk.
So
you're so right. It's actually, much of it is pretty basics, and much of it is just realization. And we do that for everything else in life. Whether it's a financials or whether it's even driving a car.
Absolutely, let's be careful. Thank you so much, Dr. Seth.
Wonderful talking to you.
I think this has been extremely helpful for our audience. Thank you, Dr. Seth. That's it for Your Health Decoded this week. Join us again next week.